Hello, everyone. Hello. Welcome to this session of Tuesdays with Tina, where we talk about how to make our patients' experience with local anesthesia a little bit better. All those times when your patient is jumping and squealing and all of those different things when they're getting an injection. So let's just talk about some of those tips. And this actually comes from one of you. One of you guys reached out to me and said, do you have any tips? What am I doing wrong? What can I do different to make this a more enjoyable experience for my patients? And so that's what we're doing today is I'm bringing that information to you. So I've got Instagram over here. Hello, Instagram. Happy to see you guys. And YouTube right over there. Now, remember, all of these are being recorded and saved on YouTube. So if you miss the live at any point in time, make sure you go to the Teacher Tina RDH YouTube channel so you can watch any of the back comments on any of that stuff. So just so that you are aware of that. Okay, perfect. So like I said, this topic came from a viewer, a listener, a follower of mine who really had this question of, I see a patient, and when I give them an injection, my patient kind of moves around or is concerned or feels pain or squeals or takes deep breaths, they jump. What can I do to make this a better experience for our patients? So I have a few items that I'd like to share with you guys. And really, a lot of this stuff can be used for all of our patients and for the entire procedure, right? The entire patient procedure, which is one, let them know what's going on. Anytime you have a patient in your chair, if you bring them back into your operatory, tell them what you're doing. Like, make sure that they are aware, especially if they're kind of anxious. An anxious person may want to know more, but I would ask them, because there are some people who are pretty anxious that might say, I don't want to know. Don't tell me anything. So find out for them, like, how much detail would you like to know about what we're going to be doing today in regards to that? So that's one thing that you can do. The other thing is, especially with our local anesthesia, is applying our pre-anesthesia, our topical. Normally it is that non-injectable topical gel, like that 20% benzocaine, comes in lots of different formulations. You want to make sure you do that. The other thing that you can do to reduce the sting for your patient, reduce that burning sensation for your patient, is to go through and actually use a buffering agent. Have you ever heard of a buffering agent? So if you've heard of a buffering agent before, just go ahead and in the comments, if you've heard about it or if you want to know more, I go into detail with buffering agents in my book, Hit Me With Your Best Shot, the Anesthesia Resource Guide for Oral Healthcare Professionals. There's some great information in there. And I even talk about this, like how to make the patient's experience better for your patient when you're giving injections, and also even for when you're for you yourself, how to gain confidence and how to make your experience better. So but I would definitely use buffering. The thing about buffering is what it does is it takes that really acidic anesthetic solution and makes it a more neutral environment. It takes the sting out of there, and it also makes it more effective. Now, currently there's a couple different buffering agents on the market. I encourage you to look those up if I can let you know. There's Onset, and then also Septidon and Premier teamed up, and they have another one called Buffer Pro. So those are really right now your two big buffering agents in the industry that you can do. Now, sometimes people will ask me, what about if I warm my anesthetic up? Will that make a difference? Slightly. We want to make sure we don't harm the integrity of that anesthetic, right? So we don't want to put it under a lot of running water. I know a lot of people will let it sit in hot and soak in a cup of warm water or run it under running water. We don't want to do anything that's going to disrupt the integrity of the rubber stopper, that metal cap, that latex diaphragm on there, the rubber diaphragm on there. So I encourage you not to do that. You can use an anesthetic warmer sometimes, which is basically like a little plastic thing with a light bulb in it. You can rub it in your hands. If you're ever a Karate Kid, I call this Mr. Miyagi style. Okay. If you're a Karate Kid fan, you probably know what that is. But You can warm it in your hands. That can help slightly. Research doesn't state that it makes a huge difference, but that could be of help. Using a fresh needle, if it's barbed needle, it's going to hurt a lot more. If you really retract retract that patient's look back, that can be helpful. And just like with anything, when we insert it in, we want to do it nice and slow. Okay, have a nice firm grasp on your syringe and insert that needle nice and slow, and that will definitely help your patient feel a little bit better as well. So some items there for you to think about and consider. What else can we do? I like to empower my patient. Anytime I'm giving my patient an injection, I like to empower them to let them know it is their appointment. And while I may be leading it, they have input. So what I'll do oftentimes is go ahead and go through and tell them if they ever need me to pause or stop to raise their hand. Now, I'm right-handed. I tend to do most of my injections on the patient's right side, so I will actually tap their left hand just to make sure they remember which hand to raise. We don't want them raising the hand that we're on, the side that we're on. The other thing is sometimes just giving them the suction so that they can turn it on and vacuum out their mouth as soon as they're done. Okay, so those are some things. So to recap, review with your patient what you're going to do. And I'm going to throw into that also empowering them to be involved in the appointment, communicating with you of if they need to take a pause or a break at any point in time. The other thing is applying your non-injectable, your topical gel. More than likely, it's going to be the 20% benzocaine. Now, I did, for those of you that have been following this whole entire time, I didn't mention with palatal injections, if you apply some really firm pressure, like with a cotton swab, and maybe even you can use ice, you can use non-injectable topical gel, that will actually really help quite a bit with the pain of insertion with our palatal injections. Buffered anesthetic, use that buffered anesthetic. It really takes the sting out, makes that acid more neutral, and makes that anesthetic a lot more bioavailable, so you get faster onset. Inserting your needle nice and slow, depositing your anesthetic nice and slow, and also making sure you have a nice fresh needle. Now, the other thing too is don't turn your patient into a sounding board, right? When we're inserting that needle, you don't want to go through and hit the bone and come back and forth and back and forth and back and forth. So be nice and atraumatic with your patient. And also just know it's normal. It is very, very, very normal for our patients, even when we do all of that. It is very normal for our patients to hold their breath or pull back or make any kind of squeaky noises. It's very normal for a patient to feel a zing in their lip, a zing in their tongue. It just means that we're close to the nerve or right on target. And it's really important to tell your patient that that is a very common thing and to forewarn them ahead of time, okay? All right, so those are some things that we can do to make our patients' experience a little better, a little more enjoyable when they're getting an injection. If it's the first time, they may have a challenge with it all. So I thank you guys. I appreciate you being here. Hello, Instagram. Thank you again for showing up. As a reminder, you can find these recordings on Teacher Tina RDH YouTube channel. And I want to let you guys know exciting things coming up this weekend. I will be in Georgia doing an anesthesia certification course for some hygienists in Georgia this weekend. I'll be back again in the end of the month, and then also again in mid-February. And then for those of you that have been following along, Oregon has now approved dental assistants capacity to administer local anesthetic. So I will be hosting a workshop for them starting in April and getting more and more of those going. So that's pretty exciting news. The other thing that I think is exciting is if you haven't already seen, and I will try to put a link into the comments or into like a comment on Instagram or onto YouTube, that Dental Post has released their salary survey, their 2024 salary survey. So all through 2024, there was a survey done of dentists, dental assistants, hygienists, front office to get an idea of your job satisfaction, your compensation, what kind of money are you making? What kind of benefits do you get? When do you plan to retire? What motivates you to stay? Why do you think you might leave the position that you're at or the office that you're at? So I highly encourage you to go and check that out. Like I said, I'll put a link. I put a link in my Instagram stories yesterday, but I'll put another link in some of these comments here so you guys can have access to that. It's some really great information, and stay tuned as Amanda, Kim, Allie, and I share more information about that on our podcast, Dental Bites. We take a few episodes and talk about that. So, all right, friends, that's what's going on in my world for the next few weeks. If you are somewhere where you would love to have me come and do a hands-on workshop, a certification course, or have me come and speak to your area, reach out. Let me know. I'd love to come and share my passion of anesthesia, medical emergencies, head and neck anatomy, and all those other wonderful things, career development. Okay, I think that's it. Have a great week, friends, and I will see you next week. And let me know, what should we talk about next week? Because like I said, this was all listener driven. You asked questions. Here it is. I'm answering them. All right, friends. Cheers. Bye-bye.